Good afternoon, everyone. Welcome to today's COVID-19 media availability with the Southern Nevada Health District. I'm Corey from the Office of Communications, and I'll be moderating today. If your camera is currently on, we ask you to please disable it at this time. To ask a question today, please use the raise hand feature, which is located at the bottom of the participants list, or type your question into the chat box. If you're joining us by phone, press *9 in order to raise your hand. Thank you all for your participation today. You do have our permission to record this session. We're now ready to begin. Dr. Johnson?
Thank you, Corey, and good afternoon, everyone. Thank you for joining us today. I'm Dr. Michael Johnson. I'm the Director of Community Health here at the Southern Nevada Health District. Let me begin today by sharing our latest numbers. Currently, the Southern Nevada Health District is reporting 4,473 confirmed cases and 238 deaths from COVID-19, and we estimate 3,659 people have recovered from COVID-19 in Clark County. In addition, our hospital capacity continues to remain stable, and our numbers, as we've mentioned before, have been plateauing, and we're beginning to see a bit of a decline in some of the indicators that we're looking at, which is also good news. And also good news that our collective social distancing efforts are working. So happy to see that. I'm joined today by Holly Hansen, our manager of the Southern Nevada Public Health Laboratory here at the Health District, and also Dr. Kraushaar, who's our medical investigator. As you may be aware, the Health District has been collaborating with our jurisdictional partners to provide testing, community testing resources to seniors and particular minority groups, as well as those who are most at risk for COVID-19. And we're working to expand our community testing sites literally as each week passes. We've also made some changes to our daily report, and we're working on a dashboard, and the report has been revised. Hang on, I lost my screen here. We may have to hold for a minute.
I think we can see you, Dr. Johnson.
Can you see me? Sorry about that, everybody. Okay, so we've made some changes to our daily report that we provide on our website. We're working on a dashboard, and the report's been revised to match the information that'll be provided on the dashboard. These reports will also be posted later each morning as we coordinate our reporting efforts. We'll be able to answer questions about changes to that report today too. So with that, let me open it up to questions to you all. And as always, Corey Burgess will do an excellent job moderating.
Our first question today comes from caller ending in 2962. Please go ahead.
Hi, it's Dana Gentry from the Nevada Current. Can you tell me the actual metric that you're watching? Is it the new cases as a percent of tests? And if that's what you're watching, I mean, I'm watching that, and it looks like in the last 14 days, 8 of the days have been an increase and 6 have been in a decline.
Sure. Well, good question, Dana. We're looking at a number of indicators in addition to just the cases, and I'll ask Whit to expand on this in a moment. But in addition to the number of cases, we're also looking at the number of hospitalizations. We're looking at the number of deaths. We're looking at, as I mentioned, hospital stability by percent of beds that are occupied, percent of ICU beds that are occupied, percent of ventilators in use. Let me ask Whit to give you a little bit more detail on the cases.
Yeah, I think, there's no one perfect metric that sort of encapsulates the entire outbreak. So we're reviewing a variety of indicators. Like Dr. Johnson said, new positive cases they're very important, but it's very influenced by how many tests are being performed. I think hospitalizations and deaths, to me, the trends in those are very important. We're also looking at laboratory testing. We're looking at the proportion of people who are tested that are positive. So people who, for example, someone who, goes and gets tested, if, normally there are several samples collected. So if one of those samples are positive, then that person would be considered positive, versus the people who didn't have any positive samples, so versus the negative. So that's one metric we're looking at. We're also looking at just the proportion of total tests that are positive. So, there are a variety of different indicators. Another thing that sometimes that I think is important to look at as well is when people's symptoms started. I think this is something we're going to be posting on the dashboard as well. So far, when we report this data, it's based on sort of the report date. So as we find out about the information, we're giving it out. But one of the most important things is looking at the trend based on symptom onset date. So that gives you a sort of more clear understanding of the transmission that's happening in the community, assuming that that most people will go from being infected to developing symptoms within a certain time period. So yeah, so there are a number of indicators. I think we're sort of looking at all of these holistically rather than just one indicator over another.
Yeah, exactly.
Our next question today comes from the caller ending in 7309. Please go ahead.
Hi, this is Michael Davidson from the Las Vegas News. My question had to be about the number of recoveries that were announced today. There was a large increase. It increased by about 600 estimated recoveries that the health district reported today. I was just wondering, that's a massive increase compared to days prior. I'm wondering what led to the estimation raising so quickly.
Right. Good question. Good observation. We're as you probably have observed, our recovery rates prior to the one reported today have been right around, in the high 60s, anywhere from 64 to 68%. Today, the recovery rate was around 81 or 82%. Our epidemiologists are looking into this to determine if what this may be a function of, because you're right, it's a big increase, and we want to of course know what we can attribute it to. I know, Whit, you've been taking a look at this data as well. I don't know if you want to add anything.
So yeah, so this sudden large increase just from yesterday to today, I mean, that looks a little bit, I don't know, we want to verify that that's accurate. So I think our epidemiology team is really looking into that to make sure that that is something real and not an error somewhere. So we will be, I think, like delving into that, and if we find it that this is an artifact or an error somewhere, then we'll definitely make that known. But yeah, that's all I can say now.
That's right. And I would just mention, as kind of a related point, is that for a number of the indicators and trends that we're looking at, we're also calculating 7-day moving averages to kind of eliminate some of the noise in the up and down bumps that we see, to have maybe a little clearer picture of trends over time. So the data doesn't show as many peaks as valleys, if you will. But we'll keep everybody posted on the big increase in the recovered and what we can attribute that to.
Ed Comenda from the Reno Gazette-Journal asks, has the health district provided a report to the local empowerment advisory panel, and can we have a copy of it?
Our staff are working with the LEAP group, and I'll have to confirm with staff if we've actually provided them with our first report. I know one of my staff has been working on that, and I know several of our disease surveillance and epidemiology staff are helping to contribute to that report. So I'll have to follow up with you to determine if that's actually been provided to them yet. But we will be working closely with them.
Our next question comes from Mary Hines. Please update on testing in targeted communities through strike teams, mobile clinics, and drive-through testing.
Yeah, hi, Mary. Good question. Well, we've been, as I mentioned in just my opening remarks, we've been very active in stepping up our community testing here in Southern Nevada. Over the past couple of weekends, we've actually done what we're calling strike team community testing in particular hotspot areas here in Southern Nevada. Many of you have visited our website, have seen our city and zip code maps that identify the range of cases by city or by zip code, and we've used those data as well as other data to target our community testing efforts. Over the last couple of weekends, we've been testing in North Las Vegas, city of North Las Vegas. We conducted 2 weekends ago tests of primarily African Americans and those 65 age and older. Some days it was by appointment only, some days it was open to all residents of North Las Vegas. On April 25th and 26th, we were at the Martin Luther King Junior Senior Center and the Rose Garden Center on the 26th. Last weekend, on May 2nd and 3rd, we were at Canyon Springs High School in North Las Vegas with a successful event where we were able to test 304 individuals on the 2nd and 400 individuals on Sunday. The Saturday was by appointment only. The Sunday was open to the rest of the public. Looking forward, we have a number of other testing sites that we're planning and working with our community partners on to test over the next throughout the next weeks and weekends. So we'll have that information and data as we solidify it, and we'll be sharing it with you.
Our next questions come from Darcy Spears. One moment, I'm unmuting you.
I'm unmuted. Thank you very much.
Mm-hmm.
So I just have a short series of questions strictly about antibody testing, looking at when and how that's going to become available, who can get it, what will it look like in terms of like a blood draw or a finger stick, what's predicted to be the reliability percentage, since that's been variable with what's already out there. How will the tests be used, the info from the tests be used? And then I have one more after that. I just don't want to throw too much out. I'm trying to get kind of a full picture of what's coming with antibody testing.
Okay, great. Well, I'll start generally, then I would ask Holly and Whit to elaborate on this. But our laboratory is currently working on validation studies of a couple of different antibody tests, and Holly can provide more detail on that. And we will, once validated and ready, and we will be rolling those out into the community. There are a lot of antibody tests that have been out on the market, and some of them good, some of them not good. There have been some concerns, and Whit can certainly expand on this, on the sensitivity of antibody tests to pick up specific antibodies that suggest immunity to COVID-19, some cross-reactivity where they, it might be picking up other coronavirus antibodies, not necessarily COVID-19 antibodies. So we're working very collaboratively here internally at SNHD with our lab and our disease investigators and epidemiologists on getting ready for this rollout once it's the validation studies are done. So let me ask Holly and Whit to elaborate a bit more on this.
Hey, this is Holly Hansen. I just want to tell you that the platform that we already have in-house that we will be putting the antibody testing on is already set to go. Not open to the public yet. We still have to validate that. But the sensitivity and specificity for this test that we're bringing in is 95 to 99% sensitive and specific. So we did some investigation on that, and it's already EUA approved. So we wanted to make sure that we could offer the public a test that is reliable. We have done some research on the lateral EIA tests out there, but we're still researching that, and we're listening to what the CDC and FDA have to say on that before we decide on a certain test for that. The test that we have and will have will be a blood draw. It's either by plasma or serum that we will test, and it's not considered a point of care test. It's not a finger stick. So that's what I have right now until we get it validated and ready to open up.
Do you have a target time frame and an idea about the scope of the availability? Is it just going to be, you know, frontline healthcare workers at first and eventually the general public, or can you give me an idea?
I can tell you that we will probably be online by the end of next week, and I do not know who it will be available to. Maybe I can confer to Dr. Kraushaar or Dr. Johnson on that.
Well, I think I haven't been part of those discussions about who they're going to be available to. I can tell you that one thing I wanted to say though is that SNPHL is not the only place that's going to be, or sorry, SNHD is not going to be the only place with these sort of tests. I do know that providers in the community and commercial labs are already providing some of these tests, so they are open to the general public. Where you go will determine what exact tests they're going to be using. So we can't speak more generally on, you know, the sensitivity and specificity of all the tests that are being used in the community. Well, one thing I also want to say is that the situation now is very much like it was in the previous calls over the last couple of weeks, in that if say we have a very sensitive test that's also very specific and it's positive, then it gives us some sense of, you know, the prevalence of this disease in the community, or like how many people may have been infected in the past. Sorry, I'm hearing little echoes. Anybody else hearing an echo? No, okay. Yeah, but we still are a little bit unsure about what that means in terms of long-term immunity. I know that there are a lot of studies that are being done looking into that question, and different antibody tests are also looking at different parts of the virus. So an antibody may be from one test, may be looking at one particular protein on the virus, and another antibody test may be focusing on a different area. And there is already evidence coming out that you know, one part may be a little bit better than another, or one type of antibody test may be a little bit better than a different type of antibody test. So there's so many unknowns currently. So I think the best thing we can do right now from these is to get a sense of like the prevalence in the community.
And
Darcy, let me add, this is Dr. Johnson, yeah, to your question about who, just like we've been doing right now with the PCR, the swab tests for individuals in community testing, it'll probably be a mix still of our strike force teams doing targeted hotspots and targeted population groups with both the nasal swabs as well as the antibody tests when ready, as well as like I mentioned last weekend, we did appointment only at Canyon Springs High School. On Sunday, we opened it up to all residents of North Las Vegas there. So we'll do kind of a combination of that as well with the antibody testing. And these events vary in size. As I mentioned last weekend, we did 304 and 400 tests respectively. The weekend prior to that at the senior centers, we conducted 190 tests on Saturday and 89 on Sunday. Others may be much larger than the Canyon Springs. So for some of these, we can send out small strike force teams. For others, we send out our mobile clinic with up to 7 to 10 stations, drive-through stations for people. So they vary in size and scope and targeted emphasis, but that's the plan at this point.
Okay, just a reminder to everyone, use the raise hand feature to do any follow-up questions. Our next one today comes from Dana Gentry.
Hi, thank you. As you know, there have been protests against the governor's closure orders, and there are people who are concerned now that with businesses already giving out instructions about how their guidance about how they're going to open, that it's a foregone conclusion that phase 1 will occur on May 15th. What assurances can you give the public that the decisions are being made on the basis of data and not on public pressure?
Well, that's a very good question. We have numerous calls most mornings of the week with the governor's office and other health officials from other health districts and the director of the Department of Public and Behavioral Health, where we all share data with each other and provide our respective updates for our respective jurisdictions. And this data is of course communicated to the governor's office. We also work very closely, as I mentioned before, with the LEAP coalition task force that's been put together, as well as the governor's medical advisory board. So we're very involved in providing the public health evidence base for where we are with COVID-19 and where we need to be with respect to reopening. So the governor, of course, has taken a very strong evidence-based public health stance to this pandemic, and we support that. So we work very close on with him on these data. So it's an evidence-based informed decision, in my opinion, and not in response to protests or other political pressures.
We're going to take another chat question. This is from Ed Commenda. What role will SNHD play in tracking the effects of reopening in order to ensure everyone has best available information about how much reopenings of individual businesses increase the spread of the pandemic?
Well, we have been and will continue to work very closely with the resort organizations and numerous businesses here in Southern Nevada. Our Division of Environmental Health Director Chris Saxton and his staff have been providing a lot of guidance to help businesses think about and plan for reopening based on guidelines that we're providing, based on CDC guidelines, and a lot of Q&A. So the health district's very involved in making sure that once businesses can reopen, that they're taking the necessary precautions to be safe for their employees as well as their customers.
I would also like to say that one of the things our disease investigators do is when they reach out to one of the someone who tests positive, is they're trying to identify locations such as where they work. And if we start to see a cluster of cases occurring in the same region or the same facility, then that's a strong cue to us that that's something we need to intervene in. So in situations like that, we may send strike teams to facilitate testing.
Yeah.
And we have another voice question from Michael Davidson.
Hi there. This one's kind of a question about some retroactive information, or I guess from April and still being measured today. But when you guys look at, the number of patients or hospital beds that a hospital has filled, or ICU rooms that has filled, or ventilators that are in use, as a percentage of the hospital's total capacity for any of those things, is there, considered a danger zone? That's just a term I'm making up off the top of my head. Or basically, if it were to get above a certain percentage of use or capacity, that you guys would take concern about that, especially during a time when you can try and keep hospitals as open as possible?
Yes, there actually is criteria for the hospitals, and they essentially use different metrics for when they've hit the surge, really, for say percent of beds available, percent of ventilators available, and so on. They're also identified in the Nevada Health Association report as either in a green, yellow, or red phase, meaning that they have fine capacity at green. There's some concern, but they haven't reached total surge capacity in yellow, and red that they definitely have. Whit, I don't know if you want to add anything to that.
No, I don't have anything to add.
All right.
We have another chat question. This comes from Michelle Price. Did the 40-bed temporary hospital next to the health district office ever get used? And is the health district anticipating that restaurants will be reopening on May 15th at the start of the phase 1 reopening? The governor sounded like he was leaving that open to the county.
Well, with respect to the first question, the 40-bed facility, we're currently working with the contractor on that. It has not been put in place as of yet, but as we speak, they're working on that. So we hope to have that in place very soon. And I'm sorry, the second part of the question was what?
Does the health district anticipate the restaurants will be reopening on May 15th at the start of the phase 1 reopening? The governor sounded like he was leaving that open to the county.
Well, as I mentioned, we're in close contact with the governor's office throughout the week. We haven't received any further details or specifics on that now, but we'll work very closely with the governor's office based on what ultimately is his decision on what will open and what won't open during phase 1.
We have a voice question. This is from caller ending in 7028.
Hi, this is Sue Bell from Veteran Reporter News.
I'm sorry, you're really echoing. I can't hear you.
All right, hopefully we'll come back to that later. We have another question from Darcy. Will the health district follow WHO's request that localities track earlier potential cases than the first positive to get a better picture of the pandemic? Teamsters have volunteered to make member health data available, and members who believe they had COVID-19 in December and January would like to volunteer for antibody testing.
Well, currently, with the resources we have, staff availability and limited staff, we're focusing on the current cases we have and on mitigating disease moving forward. So that's where the emphasis of our efforts and our resources are being put, not retrospectively. Once we get past COVID-19 and things relax a bit, it's likely that our disease investigators can look retrospectively at some of these cases. But right now, given the number of cases and contact tracing that we're required to do, that's where all of our efforts are going. And I might mention that we're working with the WIN as well, with our staff and their staff, in developing a call center to developing a call center to follow up with people who have tested negative and provide them with their results, and also to determine if they have, ask them a series of questions to determine if they have any social service needs that the county can be helpful with.
Could I comment on that, Dr. Johnson, about the testing?
Yes, please. Absolutely.
Yeah, I mean, I think this is a very interesting question, and I think every region across the country sort of would love to know like when this exactly started. And I don't know about you guys, but I think for myself and everyone I've talked to, you always remember, okay, like it was December, it was January, and I had this really bad cold, and it doesn't help that this overlapped with flu season basically, so that's difficult. It's not as useful after the fact to look and see who tested positive with their antibodies. I think for this type of study, you would have to look at people who had blood tests and things like that done earlier, so like in December and January, and if they still had those samples stored, then test those samples. And I think that would give you a better sense. Even then, if you had a positive result, when you do, just say you have a test with, that's 95% sensitive or something like that. If you're testing in a high prevalence setting, then you know that most of the time those numbers are going to be correct. If you test in a low prevalence setting, where just say before COVID even started coming around, if we test a lot of people, you're going to have a higher chance of having false positives. So even in that situation, if we started to see positive tests from just say January, December, we wouldn't really know whether those are true cases or whether those are false positives. So a lot of, I think these type of studies are better done in like a academic setting, especially centers that have maybe collected blood samples for other studies. It's, I think, certainly something I would love to look into in the future, but I think our priority right now is sort of controlling the outbreak that's happening.
Absolutely.
Our next voice question comes from Vanessa Murphy.
Hi, thanks for taking my question. How often are you communicating with the Nevada Gaming Control Board? And as of today, what do you think is a safe date for casinos to reopen?
Well, we communicate with the Gaming Control Board probably on a weekly basis, oftentimes through the Multi-Agency Coordinating Center, our MAC, or other specific calls, conference calls that we all may be on. You know, there are specific indicators that the CDC and the governor has laid out for the reopening of Nevada, which of course would include the casinos. And so whether it's the casinos or other businesses, I think meeting these particular criteria of, you know, a 14-day decline in cases, in hospitalizations, hospitalization stability, which we appear to be reaching, looking at positivity rates, looking at increasing community testing, which is happening all over the state, and certainly here in Southern Nevada, as I mentioned, and increasing contact tracing. As I mentioned, we have been doing, and we've stepped it up through the WIN as well. So yeah, there's a number of indicators that we're looking at, and where we need to be to determine when it's actually going to be safe to open into phase 1 and phase 2 and phase 3.
We have a question now from Kyle Wilcox. He's asking, how is the health district preparing for a potential increase in cases once we reopen?
Well, Whit, would you like to handle that?
Sure. You know, I think, you know, thankfully we've seen a plateau or even a decrease in cases, at least since around like early April. So we are, you know, definitely focusing our efforts right now on contact tracing. I think we still have room to expand, and I think that the contact tracing effort is really vital to controlling things when we reopen. I mean, I think the biggest issue is that if we start to see new cases flare up, if we start to see more cases in a certain region, we have to know about that very quickly, and we have to be able to respond. We have to make sure that all those the contacts of those cases are quarantined. So, I mean, it's every week I wish I had something sort of more interesting to say, but it really just comes down to the contact tracing and making sure that our disease investigation staff have the tools they need and the manpower they need to investigate all these new cases.
Right. I mean, certainly, and we've mentioned it before, the more community testing we do, the more cases we're going to find. And that's not a bad thing, because then we can determine who is positive out there and make the necessary recommendations and steps to have them self-isolate, if treatment's necessary, and so on. So we appreciate everybody's patience and just kind of hanging in there while we work very hard to help support the reopening.
And I have a question here from Z asking, what is the health district's view on sporting facilities such as Las Vegas indoor soccer and longevity preparing to open their doors on May 17th when their activities are contact sports?
Well, you know, we want to make sure no matter what business it is or event it is, that it's done safely. And as I mentioned, our environmental health folks are working with a variety of different kinds of businesses and activities to help plan for a safe reopening. As you're probably aware, around the country, around the world, with some of the reopening, there are fanless events that are occurring. Whether that happens with indoor soccer or some of these other really kind of remains to be seen. The health district's position is, as it's always been, is the public health is our number one interest. So whenever reopening happens with whatever business or venue, we want to make sure that it's done safely and precautions are in place for, in this case, both the athletes as well as the fans.
Lauren Clark is asking, what testing capacity do our rural areas have, and what is being done to make sure that those rural areas are accounted for?
Well, the state is also very active in rolling out and increasing community testing, and that involves many of the rurals. I know up north there is a quad county area around the Carson City area, 4 counties that the Carson City Health District works with very closely. And I know the Washoe County Health District in Reno does a lot of outreach as well with rurals. We down here in Southern Nevada, we work very closely with Nye, Esmeralda, and Lincoln counties. We're looking, as we move forward with our community testing, to expanding into Mesquite and Laughlin and some other areas around here. So we're doing increasing community testing not only here in Clark County, but also in some of our neighbor rural counties as well, and cities.
And we have a voice question from Michael Davidson. Please go ahead.
In the last couple of weeks, since it was made known that a person who attended CES and felt sick afterwards received an antibody test, and that showed that at some point, indicated they had COVID-19. There's been a lot of speculation about whether that disease was present at CES, transmitted between people at CES or other conventions here in Las Vegas. At this time, does the health district have or know of any evidence that would, solid evidence that would indicate that the disease was here during CES or at any conventions in December or January, or is there not evidence supporting that at this point?
Right. We don't have any evidence supporting that at this point. And actually, part of our protocol is that if visitors come here from another state, such as for a convention, and become symptomatic, say upon returning home, those symptoms and tests are typically done in their home state. Then that laboratory would then report those results to our lab, since they were a visitor here in our jurisdiction. But we're not aware of any cases. And as I mentioned before, we're spending our resources right now on trying to manage the disease, which is quite a bit that we have in hand right now, and not looking at retrospective questions.
Okay, the following 2 questions are going to be our last ones for today. Mary Hines is asking, for what percentage of cases are you currently able to do contact tracing? And M. Brunker is following up on Mary's question with, are there criteria that you use to decide whether to track and notify close contacts of diagnosed cases? If so, what are they?
Whit, would you like to take that?
Sure. Yeah, I would have a hard time giving you an exact number. I think that's something that perhaps we can look into and try and make available in the future, but I don't have that number off the top of my head. Dr. Johnson, do you have anything to add with that first question?
No.
Okay. What was the second question again?
What was the second?
Are there criteria that you use to decide whether to track and notify close contacts of diagnosed cases? If so, what are they?
So for every time we get a positive test, we have a sort of algorithm that we go through. There are certain priority populations that we look at. So any death is a priority for investigation and for identifying contacts, any hospitalization as well. People from certain occupational groups are considered high priority. So, we have a sort of algorithm that we go through. We change this algorithm a little bit depending on our needs at that particular time, but yeah, we do have a process that we go through.
Okay, Dr. Johnson, do you have any final words? We do actually have 2 more questions that just snuck in. Would you like to take those?
Sure.
Okay, Vanessa Murphy's asking, moving forward, what is the health district's advice on masks for employees at businesses and for customers?
The health district has been and is continuing to recommend that folks wear masks when they're in close contact with other people or out in public, such as going to the grocery store, to the pharmacies. These masks don't have to be N95 masks, but they can be cloth masks. There's a variety on the market right now to really protect not only themselves but others. Many of the cases of COVID-19, in fact, upwards of 80%, people may be asymptomatic or have very mild symptoms and not even know that they're positive and could be shedding the virus. So it's important to wear masks to protect others as well. So that's our position on this. I would also say that we just, as we move into this next phase of beginning to reopen our state, that we just ask people to continue to take the steps to protect themselves. And that would include not only wearing masks, but also staying at home and practicing social distancing, certainly washing your hands, sanitizing surfaces that we've been mentioning, but are extremely important in helping prevent spread of this disease.
Okay, and Rania from Fox 5 has our question. This will be the final question for the day.
Hi, this is Ronnie Casa. I have a question in regards to medications being used. We have seen remdesivir being used recently to treat COVID. Are you guys using anything specific, or do you have any drugs that you're looking into?
We are not using anything specific, although we certainly track very closely the CDC and WHO and FDA guidelines. Whit, would you like to add anything about medications?
Sure. As Dr. Johnson said, I can't comment on, I'm here in my capacity here. I'm not actively treating patients, so I can't say what I would use here. But as I understand it, there's the most evidence behind remdesivir at this point, and with hydroxychloroquine and things like that, they're much more likely to have side effects. So I think, given that we have a potentially useful drug, then I would recommend steering away from other drugs where we have less data at this point. I think also hospitals are looking into things like convalescent plasma, and those are things that I think different hospitals and different providers are considering.
That's right.
Okay, thank you, everyone. Panelists, do we have any further comments for today?
I'd just like to thank everybody for taking the time to join us today, and we'll look forward to hearing you and seeing you on our next media availability. Thanks.
Thank you.
Thank you to everyone for attending today's event. If you have any further questions, please reach out to our Office of Communications. Have a safe and healthy week, everyone. Thank you.